Dates and then send it over to Tara.
Yeah, that sounds good. Okay, so I think the echoing has stopped. So the agenda today, we wanted to start off discussing the nurse pipeline program. And so Tara Murphy, she's been working with me and Wendy on this, and she would like to present some slides and prompt some discussion in the group. And then I have a few questions that I'd like to ask regarding recommendations from the strategic plan and just the status of those. We'll be presenting to the legislature at the end of March, and we're hoping to have the status of all of the recommendations updated to inform them. And then I have a few more updates just on the state of different aspects of the strategic plan. And I think then, we have some time at the end for additional updates from anyone on this meeting. So
Great. I thought I realized I didn't put this in the beginning of the agenda, but it was just going to give a couple of updates, perhaps for context for Tara's discussion items too. One is just some of you are aware the premium pay program round 2 is currently open for applications. The application period closes on the 27th. So if you know anyone who hasn't started or is in the middle of sort of getting their application ready, please encourage them to submit by the 27th. So we can get dollars out the door to be spent this fiscal year. The second piece is that we've talked previously about 2 Act 183 grant opportunities. We're very close to releasing the Nurse Preceptor Incentive Grant Program application. We're waiting on this final decision about whether or not we can access less restrictive funding for this program. So we're sort of quite ready to go using the funds that we have available. But if we can use this additional different route, it would really reduce provider burden and administrative complexity. So we're just in a short holding pattern, but hope to be able to get that final decision, I'm hoping this week. We are similarly waiting a final decision on the nurse apprenticeship and pipeline program. Similarly, could we use a different funding source to reduce burden and meet more of the legislative intent? But at this point, we want to focus on the few outstanding policy decisions that we have. And Tara is here to walk us through some of this. So thank you for letting me take some of the top of the agenda for those updates. Tara, do you want me to share slides or did you want to share slides?
Wendy, it would be amazing if you could share them since I do not have a good sharing function on my computer. So.
I can do that. And it looks like Devin has a question.
Yeah, so Wendy, are those the flexibilities in the Budget Adjustment Act? Are you saying once the Budget Adjustment Act is out, then you'll be able to put out those applications?
So the funding has been a little complicated, trying to find a pathway for being able to do this effectively. There's a way, so the Treasury, so these are funded by state fiscal recovery funds. There's Treasury rules that we've sort of had to follow with each program. So for the nurse preceptor, we've been having to follow the premium pay rule. There's also an ability for states to use a certain amount of revenue loss. It's a small amount compared to the overall amount of state fiscal recovery funds available. So we've sort of put in this request to use this revenue loss category of the state fiscal recovery funds. Not sure because there's obviously a lot of competing pressures on trying to use those funds, but that's, if we do, it doesn't have to be rolled out in the same way as a premium pay program would have to. So that reduces the burden. The BAA
Sorry.
request
And
is separate. Like we lost you, Devin. Sorry, did you say, I missed what you said, Devin?
I'm sorry. I'm just looking for what you think the timing might be. So it sounds like it's more
I'm
of a
sorry,
federal
it's being
thing than a
really
state thing.
wonky. So we were hoping to hear as early as this week. So I'll continue to follow up, but we can get out the program as is pretty quickly. But if we can make those slight tweaks to it, it will allow a lot of additional flexibilities, and so that's why we're hopeful that would be the way that we could proceed with these programs.
Okay, sounds great. Thank you.
Thank you. I'll start sharing my slides.
Wonderful. Great. So as Wendy said, my name is Tara Murphy. I am independent consultant based in Massachusetts, and I'm part of this endeavor largely because I ran a whole host of healthcare workforce programs as part of work at Massachusetts Medicaid. So there's some kind of direct crosswalks between that work and the nursing in particular, the nursing pipeline and apprenticeship program. We wanted to just take a little bit of time to kind of get your thoughts today on a couple of key policy issues related to designing and developing out this program. So if we go to the next slide, I can give a little bit of context just as a refresher on what the program is. Again, as Wendy was talking about, Act 183 of 2022, Section 22, makes available about $2.5 million to support a healthcare employer nursing pipeline and apprenticeship program. So kind of per the parameters set up in that legislation, the program is intended to establish or expand partnerships with Vermont nursing schools to create nursing pipeline programs, apprenticeship programs, or both, that will train members of healthcare employers' existing staff members to become higher level nursing professionals. The staff members that are eligible to kind of benefit from this program may include, but we're interpreting that as may include, but are not necessarily limited to, personal care attendants, licensed nursing assistants, or licensed practical nurses. Right now, per the legislation, the funds that are available, so that $2.5 million, are sort of designated to contribute to participant tuition and fees at Vermont nursing schools, and that's kind of only, right? So this $2.5 million that is appropriated to support nursing pipeline and apprenticeship programs can be used right now to support the tuition and fees components of those programs only. As Wendy said, she's kind of she and Laura are working on figuring out if there can be a little bit more flexibility, some ways to bring more flexibility to the use of those funds, but this is kind of what we have now. So, and to take a step back, I think the bigger intent of this program is to really address the nursing shortage in Vermont, but I would say that nursing shortage is pretty much everywhere at this point. As we've been thinking through, how do we operationalize the guiding language for spending of this money? We have come up with a couple of areas where we just want to kind of check our thinking with all of you as subject matter experts and people who may be a little bit closer to the ground. These two big areas are just when we're thinking about what we're requiring of grantees to access these funds. Should we be requiring X number of elements in their program, right? So in specific elements in their program. So again, right now, we can only use the funding to cover participants' tuition and fees. But if we're thinking about putting together a sort of larger pipeline or apprenticeship program, there's some key elements that would need to be there regardless of who funds them in order to have an effective program. So number one, wanted to kind of check our thinking on that with all of you. And then we've run into sort of a question about what might be the best types of education programs to kind of sort of target for this program. So there's a number of different ways to get a nursing degree, and just wanted to again check our thinking with all of you on what types of approaches to getting that education, that degree might be most appropriate for a nursing pipeline or apprenticeship program. So we've kind of outlined some of the key questions on the next slides. I will run through them kind of one after the other because one set of questions might be a little bit easier to tackle than the others, but I'll stop there and just ask if there's any questions before we dive into some of the details. I'm guessing no, so we can go to the next slide. So again, this slide is for discussion purposes only. As we've been thinking through what elements you need to kind of make a strong and sustainable apprenticeship or pipeline program, we've kind of come up with, I think it's 6 of them, and just again wanted to check our thinking, right? So element number 1 would be that academic education program, and that would include both a formal partnership with either a practical nurse, an associate's degree nursing program, or a Bachelor of Science in Nursing degree granting program. So you need a formal partnership there with an organization that can provide the education and grant the certificate or the degree. And then obviously you need the funding for tuition and fees at such a program, right? So that's the piece that we have. There needs to be a clinical education component, and this clinical education component requires sufficient number of nurse preceptors at the employer organization, and potentially there might need to be some additional preparation for those nurse preceptors, depending on the parameters of the program and the student population. Also, again, in kind of designing our perfect program, we would want there to be financial support for those apprentices or pipeline nurses, right? So in addition to kind of funding their tuition, they are still going to need to be covering the cost of their housing, their childcare, transportation, and kind of other basic needs, if you will. We think that there should probably also be some academic support for those apprentices and pipeline nurses. So this would be really required to ensure success in program persistence, especially if we're looking at non-traditional students. So students who may already have families, who have kind of not taken the traditional road from high school to a 4-year degree program, so on and so forth. Importantly, this academic support should probably include tutoring for those licensing exams. So, right, the first step is getting your certificate or degree. The next step is actually becoming licensed to practice. We think there should also be wraparound support for the apprentices and pipeline nurses. So this would include support for career planning, social and economic issues. So kind of helping nurses kind of put all of these various pieces together. And again, kind of doubly important for individuals who may be non-traditional students who may have kind of never thought that higher education was necessarily for them, and or for individuals who might be juggling childcare and work and other family responsibilities while also going to school. And then last but absolutely not least, there would need to be somebody at the employer organization who is kind of designing and managing the program. So pulling all of these pieces together, in particular, figuring out a process for identifying and then selecting the individual employees who would participate in and benefit from this program, and then kind of managing the day-to-day, right? So we've got a few moving pieces to keeping this running. So that's kind of question number 1. We wanted to check our thinking on all of this. And then if we go to the next slide, question number 2, when we were doing some research on, it looks like there's a question from Devin.
Yeah, do you want to take comments on that first slide now, or do you want to present and then we'll do discussion afterwards?
I thought we might run through both slides all together
great.
and discuss afterwards because they're kind of related, right? So perfect. And the second might be easier. The second question might be easier to tackle than the first. But so second question, when we were doing some research into the nursing education programs that existed in Vermont, and remember that the legislation says that partnerships, education partnerships with employer organizations need to be with Vermont nursing schools, right? So this kind of eliminates a whole host of other options. When we did the research, it looked like there are a number of pathways to actually get a nursing degree, right? So the first was something that seems to be called or is called a 1+1+2 approach, which is basically a career ladder approach that allows for the completion of first a practical nursing certificate, right? Which looks to be about 3-ish semesters, followed by, and you can become certified and licensed and actually practice as a practical nurse after getting that certificate. You can then kind of come back into the program and do your Associates of Science in Nursing degree, which will lead to the eligibility for licensure as an RN. So kind of start practicing get your licensure and start practicing as an RN. And then you can come back and do the final leg of the academic work to get to a Bachelor's of Science in Nursing degree, which enables you to, obviously you continue practicing as a nurse, but it opens the door to sort of higher education and preceptorship and so on and so forth. Right now it looks like, and totally open to being corrected, that there are more programs in Vermont that we may have missed, but right now it looks like Vermont Technical College offers this approach, as does Vermont State University. There's another option at at Norwich University, which is a private university, that will enable RNs who already have that associate's degree and licensed to practice as an RN, can do kind of a fast track path to getting their BSN, and that's something that's available only online. And then there's a couple of universities that offer what look to be more traditional four-year BSN programs. So those look more like traditional kind of, you graduate from high school, you go to college, and you get your bachelor's degree. In this case, it's a bachelor's degree in nursing. And there's 3 options for that we found. So University of Vermont, Castleton University, and again, Norwich. And so as we were thinking this through, we were kind of trying to decide what, if any, might be most appropriate for what if any of these paths might be most appropriate or more appropriate for an apprenticeship program. So would it be the kind of 1+1+2 program only, or might it, might all options be equally valid if we're designing an apprenticeship or pipeline program? So those are all the open questions for now. Well, there's actually many, many more open questions, but those are sort of the key open questions that we are looking for, again, guidance and thoughts from subject matter experts on. So at this point, all questions and comments are more than welcome. Yeah, it seems like Stephanie, a hand is up.
Thank you. I'm on the first question first. And when you were talking about like the wraparound supports for the students, does that involve a component of like helping them match, like, are they with employers and employment? I just think about, so at Bi-State where I am, I'm the director of our recruitment center program, and we work with the different primary care providers, not at the RN level, but nurse practitioners and physician assistants. And we help them sort of, find employment throughout and connect them with different employers. And it helps with retention, I think, in the state. We also, we reach outside of Vermont as well as mostly outside of the state for the professions we're looking for. So I was just curious if that, potentially could include some kind of matching and like what the career planning look like and what kind of support could the nurses expect.
Yeah, and I think because this is to take a couple of steps back, what we're designing is a grant program. So we would provide the grants to the employer organizations, and we would basically ask them to tell us, we would say, here are the 6 elements that we want you to tell us that you are including in your program.
Okay.
Tell us how you will sort of meet these these requirements. Tell us.
So the
what this
employer may
element-
have someone on staff that could support these
Exactly.
components. Okay, thank you very much. I appreciate that.
Yeah, so it might look different at different, and probably would look different at different employers. I think the open question is, does this group think that all of these elements are the right ones to be requiring employers to include? And if not, like, why not? And are there any that we're missing?
Thank you.
So 2 other hands are up. And I guess, Devin, do you want to go next? I wasn't quite sure who raised their hand first.
Yeah, sure. So I would advocate for making this as flexible as possible. I really like the way CVMC did it, where they surveyed people and got feedback on what the barriers were and responded that way. The idea of sort of requiring financial support, like when I think of CVMC's program, they had the program at sort of on campus where people were working. Is that transportation help? Is that not transportation help? I wouldn't want those programs, those proposals to be weeded out because they don't fit this definition of support or wraparound services. I would much rather see a lot more flexibility in that arena than being prescriptive. I think, and when I look at the language and statute, like we do have to cover the tuition piece, and then I don't think it's a requirement. I can go back and look, but I'd much rather have flexibility around wraparound services and responding to community needs than responding to what the state thinks should be in there.
Got it. So maybe we could frame this in a way, or phrase it in a way, these are options that you could include in your apprenticeship program, as opposed to saying you must include these.
Yeah.
Okay. That's helpful. Thank you. And I apologize, I don't know everybody's name, but I see another hand up.
It looks like Maureen was next.
Yeah, so Maureen Hebert. So I helped coordinate the CVMC program. And I think one thing that was really powerful is that the participants may have taken a phlebotomy program from us, or maybe did the clinical medical certification through CCV, but they took the 4 core courses or prerequisites at CCV before they started. So it really kind of grounded them in, or regrounded them in higher education, and they had the supports through that process before they started the LPN program. But what was really important was that they were given release time, so they didn't have to quit their current role at CVMC. They were just given release time to take the courses and were given additional hours. So they basically didn't have an impact on their income. Additionally, they did receive material support, so any of the books, or if they needed a laptop or other supports. But they also had access to Working Bridges, which was really essential for many of them to kind of walk through how to manage and navigate, as well as the academic support. But what was also helpful is we had someone at CVMC that was a sort of like a project manager, but then there was like a project manager at VTC and at CCV. So we were kind of working together collaboratively to support the students. But I agree with Devin. I don't want to be prescriptive, but I want to make sure that those examples of how well that worked are incorporated in this model, because we do have information on how well it worked.
Perfect. That's great. And I'm so to your point about the release time, that's one way of getting that financial support for those basic needs, right? So that individuals are not losing income to participate. So that is something that we've been sort of explicitly thinking about under the heading of financial support, right? As an option for doing that. But I like the idea of not requiring these elements, but really pointing out that and kind of thinking as I'm talking about ways we might actually put the words on paper in the program guidance to do this. But kind of pointing out that these are ingredients, if you will, that can make for a really successful, impactful program. And so to kind of not require, but nudge applicants in that direction. And I'm wondering what this group thinks about, again, stepping away from requiring, but maybe incentivizing, including elements like these ones in the review priority scores, right? So maybe sort of saying to the extent that you are addressing students' need for academic support, need for ongoing financial support to cover basic living needs, et cetera, you will get sort of X number more points, right, to sort of weight it in that way, so that we're incentivizing groups that are providing these elements that I think in numerous different settings have been shown to kind of make for a successful program. So just open thoughts about that. And a lot of hands are up.
Can I just quickly jump in just to respond to Devin's question about sort of what the legislation says? Is it does indicate that trainees' tuition and fees shall be covered in full, and trainees shall be provided with assistance in meeting their living costs, such as housing and childcare, while attending the program. So, which is why we're trying through the BAA request to get these additional funds to be able to pay for those non-tuition and fees components. But we are sort of working within that language, indicating that it sort of is a program element. And then the legislation also includes priorities, ways that we have to sort of prioritize proposals which cover some of these elements. So I think there's various ways we can do these things, and this is really helpful, but I just wanted to indicate there are some requirements related to this in Act 183.
Yeah, and I think just to respond to that, I am worried that more resourced more resource places it will just perpetuate the sort of divide between rural and more resource places, right? Which is why if there's a way to think flexibly about, like, I know people who would look at what childcare support, how are we supposed to do that, and sort of give up. So I would want to really try to, and I'm happy to go in and work on the BAA language. If it's still, maybe it got passed out already, but like, oh man, I'm really worried that this is just going to die on the vine if there are too many requirements around it.
And I think I'd be curious if you have different thoughts on the BAA. I think the BAA language gives us a more flexible funding source to be able to pay for the those additional assistance like childcare. So that would be able to it's a more complicated way of granting, but we would be able to provide those dollars. But the priority components, what we're talking about today, I think would continue under that language. But I think we have flexibility in how we do this. I think this is going to be a really informative conversation. Thank you. Looks like Sherry's next.
Thank you. I just wanted to comment a couple of things on the structure of the program and the original question. I do agree that you've got a good plan already. I think flexibility is good. I don't think we should narrow it to just the 1 + 1 + 2. Of course, I'm a little biased to the 1 + 1 + 2. However, the traditional program, I don't want to eliminate students from wanting to do that too. So I think we should find a pathway. I don't know exactly where that should begin. I'm thinking the first year students are taking their prereqs anyway. But I also wanted to comment on the fact that I think the support at the college level is really important. So you really need one person, or at least one person, to be that connection for the program so that you don't have it fall through the cracks. And then it's, I don't know what this is, and other people, and the support for the student having that personal connection is important. So CCV, when we've been working with CCV for some of these planning programs, they have a designated person. And I think we need one at the Vermont State College level. We might as well just call it the new Vermont State University instead of all these different names that we have because we're moving in that direction. And then we are planning on hiring at the Vermont State University level more student support folks who are going to be hired and to help advise. We need one person for this strategy is at least is what I'm thinking, that's designated for that. Because, you know, a big university that we will be, and maybe even 2 people if it becomes bigger. So I think that's really important for the planning purposes, not to let things fall to the side and for students' sake. And I think that was the comment. Yeah, but I'm happy to answer any questions about any of the models of nursing because I definitely have some of that background if anyone wants to know about those. But thank you.
Yeah, no worries. I just want to make sure that I'm interpreting correctly and noting correctly. So you're saying that it's important not just on the employer side, but to have somebody dedicated on the education partner side to sort of supporting the program and the students.
Yes, because
right, yeah.
there's a lot of planning and coordinating.
Yeah.
Now, I've been involved in quite a lot of the CVMC cohort. We call it that. We call it a cohort. And there has been a lot of little bumps in the road. And if you don't have someone on the college end to say, okay, well, let's work on this and fix this, you know, the students do suffer. So you have, you know, and sometimes the biggest and greatest plan doesn't always happen. Like, you know, Devin was saying that sometimes there's things that happen. So I think that the planning piece, you know, yes, you can get it all set up, but then as it moves along, things change. And so we have to have a way to handle that on the
Yep.
college end, but also the employers take on a pretty big task with this.
Yep.
They're committing, you know, release time, which is wonderful. I hope they continue to do that. Release time, committed people in their HR department who are helping. They also have educators that help us out too, and teaching on the clinical side. So that's a lot for them. And I think sometimes that burden for a small hospital, like maybe a, you know, I'm thinking a Cottage Hospital or one of these smaller places that we have. So we do have quite a few small hospitals, Mount Ascutney. They would be challenged more with some of those little those pieces of covering all of that. Anyway,
So
I hope that helped.
it helps a lot. No, thank you. Just and take this as kind of dreaming a little bit, but so take it for what it's worth, right? Not something that we know can actually happen, but in a perfect world, if we were able, which we're not now able to do, right? So I want to be very, very clear about that. But if we were able to sort of have an element of funding that went to employers that was sort of like a grant, right? That could support all of these or some of these other elements, right? The maybe support some release time, maybe support a program coordinator, a dedicated program coordinator, a dedicated coach at the employer organization. How would the smaller organizations have the bandwidth to be able to take advantage of that, right? Because with small organizations, there's often a money problem, right? Which can be solvable if you have money to give them. But even with that, there's sometimes a bandwidth problem that there's not enough bandwidth that they can sort of get to the money to actually implement it. So just wanted to, again, this is in the, like, let's dream together, not anything that right now can actually happen, but just thought we could just might be worth throwing that conversation out. Like, so would would money solve some of the problem if we were able to make that available to the smaller hospitals and smaller employers? Or would there still be sort of a pretty big obstacle for them to overcome?
It's a great question. I think funding and resources to to hospitals and other healthcare organizations would help for sure. That being said, so I'll just leave it there. It would help.
Yeah. I mean, I ask because it kind of came through my head, right? But it also, like, I've been involved in running programs before where some of the smallest organizations that could most benefit from the extra support just didn't have the bandwidth to actually get to it. So.
Yeah, that's what I'm worried about. I mean, one of the things that I raised my hand a while back to second Devin on not making too many, not doing anything where the organizations that have already got the most set up are the ones that most benefit. I think that's a real risk. So what I find really, and I see that Johanna also, our hands shot up at the same time. I think she put a comment in the chat. But, you know, when I think about this, I mean, I'm having trouble even getting members to fully engage on this conversation, and they don't have models that they've already developed, as many as maybe some hospitals do, to even give you a model to say, hey, do it like this. So we're like several steps ahead of where our development is. And I almost feel like we need more people coming to them. I kind of am saying this now in every group like this, where it's like I'm the one, or maybe me and one member are representing, and it's a really hard way to get input from the field because I just don't know. And I don't know what questions you're going to ask me when I arrive. And so I maybe don't have all that I need from my members to help. And I don't have I never will have operational depth. So I feel like we keep doing these, like, we want to do it like this, and we really need more of you guys coming to our groups, in my view.
Yep.
To get input and feedback.
Yeah, that's that is helpful. I'm just would it sort of would having something even like sort of technical assistance for submitting applications or ongoing technical assistance for running these programs, would that be something that could bring this closer to the groups and make it more accessible to the groups that really need it?
I think so. Yeah. I think that's a really good idea.
Yeah, I was thinking that. I was like, they're just going to need the support to figure it out. And this is Stephanie. I also wondered, you know, when we went to the prioritizing these within a scoring rubric but I stepped back and thought, how, after Devin's comment, you know, how do we look at the areas of highest need, and this technical assistance that we just identified is one way to support smaller organizations in looking to different partners and figuring out what elements that they could put in and they could accomplish. But I think they probably are going to need that level of support. And so I'd like to, if we think about how to score or prioritize, I think we might want to incentivize or give more to these much smaller organizations that haven't yet tapped into some of this.
And are there, kind of thinking about this technical assistance potential, right? All of this is, we want to put like bright neon signals around this whole conversation and say it's just got like right now we have funding to do tuition and fees, right? So this is kind of for discussion only. But so if there were to be some form of technical assistance that was made available, are there programs that already exist in Vermont that could kind of be like the here we're part of this group, and we've been doing this and we've been doing it well. So here, smaller organizations, we can help show you the way. So number one, do programs like that exist, like a nursing pipeline or apprenticeship programs exist in Vermont already that could take this role? And would that be something that you think would be helpful? to kind of have an organization, an employer in the group saying, we've been doing this for a couple of years, and here, let us serve as a mentor and model.
I'd like to just say, this is work that I'm working with Sherry at Vermont State University and CCV and VSAC to present to different hospitals and healthcare organizations. So just actually, the planning that goes into this is like pretty substantial. So we're presenting it in a model that is just, for information or to gauge your interest. We have some small hospitals that are interested in participating. And in that region, there may be some other non-hospital organizations that could participate with them, and they could share clinical resources. So those are just some ideas, but I think that regionally we could roll some things out that would affect rural healthcare and small providers that might not have the ability to do it on their own.
And that's exactly what I was going to say. You can do a cohort model where smaller organizations send 1 or 2 people to a larger program. And exactly what Marianne said was to share those resources and supports for those students. It would take one sort of program manager to kind of manage that piece and make the connections. But that's the apprenticeship model has been around for ever, probably, hundreds and hundreds of years. And there are examples of other industry sectors that work with small organizations that can only manage a couple people per year. The program that unrelated, but is really strong in the state are the plumbing and electrical programs at VTC, soon to be Vermont State University. And they have about 600 participants every year. That each of those programs are 4 years in length. And they have, it's all small businesses that are engaged in that. And the preceptor / mentoring training that goes along with that could be something that, one of the state colleges or universities could provide to help support those organizations in addition to the pre-planning for this program.
Yeah.
In the case of the CVMC program, we also did sort of a demonstration model with Brattleboro Memorial Hospital, where they only had 2 people that were in the existing VTC program in Brattleboro. And that worked really, really well for them.
Good. Yeah, that's helpful. Any other kind of big thoughts or?
I have a big thought. I'm just gonna, so I always try to think about when we're putting money towards something, how do we build sustainability? So instead of just paying for something that, will go away, what are the things that we need to put in place so that when the money's not there, these things can still continue on? Because I don't think the state of healthcare is in a trend that's not going to change by itself. So the sort of sustainability pieces of this that I see is one of them, the wraparound support systems. I think that there's dollars for it, but also the systems that exist are the ones that we really need to build up. So what are the trends that people are looking for? What is the case for housing, childcare? And sort of evaluate, how we can get ahead of those things, not just, money out the door, but also sort of evaluating how they're used so that we can plan a little bit for the future. And then for the case of finance, I would recommend a loan repayment model, even though there's no dollars needed right now. If we put that in place, it could help people retain their education and employment over a period of years and have their education paid for over a short term instead of a long-term loan, that a student loan. So those are just a couple of them. I think also the development of clinical educators is really probably the most important one. If you talk to any hospital, they try to figure out how we're going to deliver clinical education. You know, the accreditation requirements for VTC and the other hospitals are all pretty significant. So we want to think about like what motivates people to do that. And, you know, hopefully there's a grant that comes through Vermont State University to help support that. But those are sustainability features, I think, that if we had money, I would invest in them.
Yeah, this has been tremendously helpful. I want to come back and emphasize that we're working with, and Wendy, I don't know if you want to go back to the first slide. Right now we're working within the confines of what the budget appropriations tell us we can do. And right now that's pretty much limited to tuition and fees, even though working in the background to figure out if we can get some more flexibility. I know that there are also timeline limits on when and how we spend, not only how we spend the money, but when we have to spend the money by, and those are pretty near term. So one thing I don't think we want to do is have like the perfect be the enemy of the good. Can we kind of get a reasonably well-designed program out the door with this funding and kind of achieve some good in the short term, right? Not just, Marianne, to your point, I don't think we want to just kind of get the money out the door. We want to get the money out the door in a way that will really have an impact and is at least somewhat thoughtful. But recognizing again the parameters that we do have, and maybe think about this as kind of the first step, and think as, and I'm overstepping my bounds here, but kind of think as a larger group in the state about like how can this $2,500 or $2.5 million again be that first step, and then build on it going forward. So just wanted to emphasize we're not going to have the ideal program that we're able to kind of put into place right now, but I think kind of talking about and thinking about and better understanding what that ideal might look like will help us do something that's really meaningful with the money that we do have in our hands right now. So, and I know that my thinking has shifted a little bit from this conversation. So thank you. And I don't want to take up your entire meeting either, but if anybody, I'm happy to talk with people one-to-one. So if anybody wants to get in touch with me via Wendy and Laura, more than happy to have the conversations.
Thank you, everyone. I'm going to turn it back over to Laura then. Thank you so much for joining us today, Tara, and for the discussion.
Yeah, good meeting all of you. Thanks. Bye.
So most of our other agenda items are actually just really updates. So it was actually, you know, nice that was such a good discussion. So I'm just actually going to post a few links in the chat because these are updates about two reports that have recently been released. And so the first I can speak to, and that is the Nurse Preceptor Action Plan, which we were required by Act 183 to present to the legislature, and that happened towards the end of January. And so we created some recommendations based on the discussions that were had during the Nurse Preceptor Working Group. There were a lot of great points raised during that working group and lots of great ideas. We weren't able to really find solutions to all of the problems that the legislature raised, but I think we have some good starting points. The link will take you to the document. I think some of the chief takeaways were that there could be some standardization around clinical mandatories and the clinical contracts that students are having with sites, and that might ease some of the administrative burden involved in getting a clinical placement. There's some recommendations that the Office of Professional Regulation explore developing a set of standards regarding simulation learning, and that could maybe be a step towards having more simulation learning if that seems to be something that's preferred in clinical placement settings, just because there are, you know, a few seats and simulation learning can increase the amount of enrollment. there's also some guidelines around, evaluating the current clinical preceptor pilot sites that are out there and looking for mechanisms that could be developed to incentivize additional sites to take up additional pilots. There's also a recommendation that's really tied to what Wendy and Tara mentioned earlier, the BAA around the $400,000 for incentive grants to nurse preceptors. And that's, the language in that is restrictive. And so, the hope was that maybe the sites that could be expanded. And in addition, I think that the action plan was a little bit too late to alter the language in the BAA, but it advises the legislature to look at ways that we could incentivize precepting, not just for students, but preceptors who work with newly hired nurses at different sites. And then finally, it's difficult to find sustainable funding streams for this work. One thing that we noticed was that there have been in the past a number of federal grants related to nurse preceptorship. And I think individual institutions within Vermont have applied for these, but maybe it could be something to consider having a more centralized application that could maybe get funds that could be used for an across the state initiative, perhaps a centralized clinical placement platform, if that seems to be, an advised step. So that's the nurse precepting action plan. The other link that I sent was the Vermont Oral Health Plan for 2022. And I think, we hope to have a speaker on this at the next meeting. I can't really speak to this plan, but this is something that the Department of Health recently released, and it has a number of points about expanding the dental workforce, about, expanding school-based dental health programs. And so it's kind of a valuable set of information about the dental health workforce as we think about that. And then another point that I just wanted to raise, and I'm going to very briefly share my screen, and then either I or Abby will send this out. Hopefully you can all see an Excel spreadsheet. I am trying to track the status of the recommendations in the strategic plan, and we went over a more comprehensive sheet at the last meeting, I believe it was, and I'm still looking just in case there are additional updates on, I think there's 6 recommendations here. I have some information about some of these. For example, I've been talking to the director of trauma prevention resilience about the organizational wellness and peer support programs, but there's also space for if anyone has any updates, for example, if an employer is doing something around supporting organizational wellness and peer support programs for the healthcare workers, if anyone has any updates about the physician assistant education program. I believe at the last meeting, someone mentioned that UVM was looking into this. So there's just a few recommendations. Like I said, I'll hopefully either I or Abby will send this out after the meeting. And if you have just any updates on these recommendations, we would really love to hear it. And if you have additional notes, there's space here to add those. And I think another update, just a brief one, is that part of the strategic plan was really trying to create a centralized location for information about the different incentives across the state. And so Luca has been working on expanding a Department of Health website that currently lists some loan repayment options and other sorts of incentives. And we're hoping to build that out into a broader resource. And so we may have some updates on that in the future, but that work is ongoing and in progress. And I
Do you know
think
what the timeline, our members are really clamoring for that information. Do you know what the timeline on that might be?
I could speak to that. So there is an update that's going to go live March 28th. That will include all of the current programs. There are still a number of Act 183 programs in process that aren't on there that we'll add as they become active. It It's somewhat, the link is very long right now, where we can get a shorter link. We're trying to figure out what that's gonna be, maybe something like healthvermont.gov/incentives. But that is something we're still working on. But yeah, so the current update that has everything that's going on is gonna be March 28th.
That's great news. Thank you.
Yeah, thank you, Luca. And we're hoping that, you know, everyone could kind of, once we have that link, that people could advertise that on their respective sites, just to make sure that it gains visibility and we can direct people towards it. So I think that is all the updates I had. We're just about out of time. If anyone has any other topics that they'd like to bring up in the last few minutes.
Laura, I just put this in the chat. I noticed that under Agency of Human Services, there's a proposal in this year's budget, administrative budget proposal for $10 million under healthcare stabilization. But then there was also some reference in one document about backfill, using this for backfill. So I just don't know, is there any information about, is this to increase a program, a new program? Is this, you know, to go towards expenditures that were already made? I don't know if anybody on this call knows that.
I'm not prepared to speak to what's included in there today, but can get that information and send it out. I don't have the adequate information to provide a response.
Thanks.
And along those lines, so with the BAA language, it sort of takes away the 2.5 million. It basically says funding left over from the retainer program. So I'm just curious if you have a sense of how much funding that is.
So for these two programs, the preceptor
Pipeline,
and
yeah.
the pipeline apprenticeship program. So right now the funding that we currently have available would remain available. And we would issue grants using that state fiscal recovery funds. The leftover funding we would have from the premium pay would be sort of a combination of likely general fund and state fiscal recovery fund. So that's where I talk about there being a more flexible funding source to meet the legislative intent. Right now, the premium pay program is we're right now going through round 2. We'll know on the 27th, like how much has been requested. I think right now our round 2, what has been requested to date has been lower than we had expected. So I can feel like there will be substantive funding available unless hopefully we get some more applications. But we can provide some more information by the next meeting on what the leftover funds look like. But there was $60 million allocated for that program. And in round 1, we spent 33.1 million.
Great, thank you.
Wendy, I'm sorry, can I just say it back another way? So are you essentially saying that how much is left over for the preceptor and other those other priorities is basically whatever's not spent on premium pay from applications? Is that what you're saying? Okay.
Exactly.
Good.
Yes.
Okay.
It's hard to know the number. It's hard to write a number without having run the program.
Yeah.
But yes, thank you.
You're backing into it. You're backing into the number. Yeah. Okay.
Exactly.
Yeah.
Wendy, in 183, it also had something about faculty pay. I'm just curious, is there any update on that?
No, that is a VDH program. I don't want to put Luke on the spot. If you're here, can comment on it. Otherwise, we can get back to you.
Yeah, I could comment on that one. That does have some significant limitations because of the source funding, and that funding didn't get changed. But it is looking like it's going to happen. The schools, they because of all the complications, they did need a long time to figure out whether they wanted to go ahead or ask for more changes. It looks like we're going ahead with that. However, it's basically, if it happens, it's basically only going to cover from last June until potentially May, if the Biden administration does go ahead and end the COVID national emergency, because the funding was tied to that. but it does look like we are going to be able to spend the funding over for that period at least.
I think, it's 11:02. I think if anyone has any further questions, they can either, email me, Wendy, or Abby, or, we can make it an agenda item for the next meeting. Thank you, everyone, for the great discussion, and I hope you all have a nice snowy afternoon.
Thank you.
Thanks,
Bye-bye.
everyone. Bye.
Thanks, everyone.